Trauma. One of the biggest things we see with trauma are patients that are involved in motor vehicle accidents, patients that are involved in accidents that were recreational accidents, be it bicycles, motorcycles, different things where they have trauma to the face, and the trauma can lead to dental fractures or chipping of the teeth, abrading of the tissues of the lips, of the mucosa inside the mouth. The great thing is that there are many treatments now that we have aesthetically that we can restore patients' dentition to their natural appearance before they may have sustained the trauma. Everything from implants to ceramic crowns to ceramic bridges. And when I say ceramic, I mean that it's all porcelain or all tooth-colored material, as opposed to not having metal restorations in it. We also have the dental profession has made many advances in composites. Composites are resins that are tooth-colored that we can actually place in teeth that mimic that basically mimic the color of the tooth as well as the characteristics of the teeth, so that we can place those in anterior or what we call aesthetic areas and able to really restore a patient's smile. With kids, we tend to see a lot of trauma that takes place when kids are in their adolescent years, when they're riding bikes or when they're playing sports, and especially in mixed dentition where they may have teeth that may be out. Like, say, for instance, many times that when patients first started getting their incise their teeth in, they may be in a occlusal relationship where they're more susceptible to dental trauma if they are involved in some type of fall or some type of trauma. So we tend to see a lot of broken teeth in those instances, and that's why we really try to stress to the parents prevention there as well by having the kids use protective headgear, athletic mouth guards, and any type of protection we can get. But kids are going to be kids, and so you're always going to see trauma there. And what we try to do is we just try to basically limit it and educate the children's parents on how best to prevent dental injuries. There are many different types of mouth guards that are on the market today. The athletic mouth guard is actually a mouth guard that is fabricated in the office or fabricated by a dental laboratory, where a custom impression is taken of your teeth or of the patient's teeth. And that guard will only fit that patient. It's a custom-made mouth guard. It covers the hard tissue, which is the teeth, as well as the soft tissue, which is the gum tissue. And what the research has showed, the rate of trauma is greatly reduced to the dentition because of the protection of the teeth and the soft tissue structures. Now, the difference between the custom guards and the kind of the bore and bite type guards, the bore and bite is basically much better than no protection at all, but they're not going to provide the extensive protection that a custom mouth guard is going to employ or is going to have. Now, as far as other mouth guards, we have something called bruxism mouth guards. And bruxism mouth guards are basically made for patients who have teeth grinding problems, or people who clench their teeth, or people that come in that have got a history of wearing their teeth down based on habits they may have where they grind their teeth or basically kind of erode their teeth away. And what that type of prosthesis does is it basically allows the patient to be able to protect their teeth from any further erosion by having a special guard made in place that they wear. And they either wear this when they know that they're when they're bruxing or grinding their teeth, or on a nightly basis. That would be prescribed by their dentist or their specialist that they see. And the third type of prosthesis would be a temporomandibular joint or an occlusal temporomandibular joint guard. Temporomandibular joint. The temporomandibular joint are basically the two joints that the jaw opens and closes on. It's a hinge axis joint. And we have a large population of patients that at some point have had problems with their temporomandibular joints. Problems being that the problems with the muscles that are around the joints, or problems with the joints themselves, or problems with the bony portions of the joints. So they basically, after a patient who has problems, we would go in for an examination to their dentist or to their healthcare professional or to their dental specialist, and have a diagnosis made of if there is a temporomandibular joint disorder, then a diagnosis will be made as to what type of disorder it was. There are many treatments that are available today for patients that do have temporomandibular joint dysfunction or problems, and so patients who may come in with clicking or popping in the joints. Most of the times patients are going to come in and say, I've got this popping in my joint, or I've got this click, or different things like that. Then you basically from there would have an examination complete on that patient to basically diagnose exactly what the if there was pathology there, or if it was a part of that person's normal anatomy. And for patients that have temporomandibular joint problems, after a thorough examination and a diagnosis, and it may be at that point it may be warranted to have a mouth guard made that basically would allow the patient to have less pain or take them through an acute phase of a temporomandibular joint problem. So that is the third and final type of prosthesis. Now, there are some other prostheses that are out on the market that are relatively new to the market. There are some prostheses such as snoring devices that are actually can be incorporated, and that once again would be a patient going into their dentist or healthcare professional and seeing if they're a candidate for one of these type of prostheses as well.